Our first community conversation today, we're joined by Dr. Justin Mutter, Medical Director of Virginia at Home. He's sitting down with Casey.
All right, thank you so much, Steve. Thank you so much for taking the time to be here today. And we're talking about some of the medical conditions that can cause older adults to become homebound. What would you say some of the most common are?
Well, really anything that can limit your ability to leave the home on your own independently. So homebound just is a medical term that means it's very, very difficult for someone to leave their home without the assistance of another person, whether that's a loved one, a caregiver. And so there are millions of Americans that are homebound across the country, and that can be from any number of conditions, neurological conditions like strokes, Parkinson's disease, things like that, but also memory disorders like Alzheimer's disease, even lung and heart conditions, advanced heart failure, coronary artery disease can cause significant limitations in people's function that renders them homebound.
Yeah, so there's really a wide range of things. How does being homebound make getting medical care really more challenging to receive?
Well, we do such an amazing job in healthcare with so much. We've grown technology to the degree that we have so many resources in hospitals and clinics now, which is a wonderful thing. We have tremendous ability to heal in that space. But for homebound persons who can't access that, it's very difficult for them to get out of their homes and get to the clinic or get to the hospital. Then that can become a very significant thing. And it's very taxing for loved ones and caregivers who really often will take, for example, an entire day out, maybe of their workday, to help their loved one who is homebound get to a single clinic visit. So because of that, research unfortunately shows that homebound persons tend to have significantly poorer access to both primary care and specialty care, pretty much compared to any other population. So it's really a population that we underserve in the healthcare system.
Yeah, it's something we'd hope will change. How does Virginia at Home program help to address these medical needs of people who are homebound?
Well, we designed our program to be good old-fashioned medicine with the house call, right? So if it's challenging for homebound persons to come to hospitals, to come to clinics, then we need to go to them. We need to bring the best of American healthcare to them in their homes, stepping across their thresholds, working with families to really achieve the best quality care possible. And so we have a multidisciplinary team that comes to people in their homes. We now serve Charlottesville City, Albemarle County, and several other counties around the area. We also serve select assisted living communities in Charlottesville, which has been a really wonderful thing for us recently.
That's awesome. This is something that's making a really big difference, I'm sure, in a lot of people's lives. So how can people learn more about this program?
So we have a website. The URL is too long to cite, but if you Google UVA Department of Population Health and Virginia at Home, you will be taken pretty much right to the site. If you scroll to the bottom, we have a privacy protected referral tool. People can refer themselves. They can get their current primary care providers to refer them using that tool. And then we will receive those referrals and think about whether they're appropriate for our program. It's a really wonderful service that we're really happy to provide to the community.
That is awesome. Thank you so much for all the work you all do, and thanks for taking the time to be here today.
Thank you very much.
Yep, we'll have you back soon. And Steve, back over to you.